New this afternoon, the city of Little Rock has reached a settlement with the family of Bradley Blackshire, according to court documents. Blackshire was shot and killed by former Little Rock police officer Charles Starks during a traffic stop in February 2019. The exact amount of the settlement has not been released right now. It could still be several weeks before kids 5 to 11 roll up their sleeves to get the first dose of the COVID-19 vaccine. But why? Brandy Smith has that answer and what parents should know ahead of the FDA's decision.
Why could it be a few weeks before a COVID-19 vaccine for children younger than 12 is approved? Pfizer officially asked the U.S. government to approve its use of COVID-19 vaccine for kids ages 5 to 11, but it will take a while before shots can go into the arms of the 28 million eligible kids in the U.S. The FDA Advisory Committee is expected to meet on October 26 to go over the data and make its recommendation. According to the Washington Post, authorization could come sometime between Halloween and Thanksgiving. So what's the data? Pfizer and BioNTech report younger kids should get a dose that's 1/3 of what's given to adults. But after the second dose, the companies report the children had the same level of virus-fighting antibodies as the adults. After testing it on more than 2,000 young volunteers, there were no serious side effects reported. This comes at a key time in the coronavirus pandemic. As the Delta variant surged in the U.S., cases in young children increased to levels we hadn't seen before. While they are at lower risk of severe illness and death compared to adults, widespread vaccinations of children could lead to eased restrictions in schools and a return to normal for some families. With the Why, I'm Brandy Smith.
Brandy, thank you. Pfizer is also developing vaccines for babies and toddlers under the age of 5, but they're not expected to be ready before next year. Pharmacies and clinics across the state are now preparing for the possible influx of parents getting their younger kids vaccinated. But with that and the recent booster shot rollout, do we have enough doses of the vaccine to meet the increased demand?
We try and hold about a 2-week supply of vaccine in the state in every county so that we're in a position to whatever happens that we're able to go ahead and get the vaccines out.
That's Colonel Robert Ader. He is in charge of the state's vaccine efforts, and he says that Arkansas has close to a 5-week supply of the COVID-19 vaccine, including Pfizer. That puts us in a good position if the FDA authorizes the vaccine for emergency use in kids ages 5 to 11. While some pharmacies are already getting questions from parents eager to have their young kids vaccinated, Colonel Ader still expects more hesitancy in that 5 to 11 age range. Taking a look at our COVID-19 numbers now, the state has crossed a major milestone this week. Arkansas has now reported 500,000 cases of COVID-19 since the pandemic started. That's about 1 in 6 people here in Arkansas. Looking at the case tracker for the past 19 months, you can see the worst waves right there. After the state started reopening, we saw a devastating holiday season surge. Then over the summer, the Delta variant swept across the country, causing another massive surge in Arkansas. But now cases appear to be on the decline once again. Experts have been warning we could see what they're calling a twindemic of COVID-19 and flu this coming winter. Now new research being presented at an American Academy of Pediatrics conference shows pandemic precautions helped stop the spread of flu and other common respiratory viruses last year. Michael George takes a closer look for us this afternoon.
The Noaker family always gets flu shots. They also take what precautions they can each winter because 3-year-old Alexander was born premature.
The doctors were very clear he needed to be protected because if he caught RSV or the flu, there was a high likelihood that he could end up hospitalized.
And the COVID-19 pandemic brought new worries.
We follow all the public health advice. We wear our masks everywhere we go.
Millions of children get sick with the flu every year, and tens of thousands are hospitalized with respiratory syncytial virus, or RSV. Now a new study shows wearing masks and social distancing stopped the common respiratory viruses from spreading last season.
Although each of these things is not perfect, taken together, they really are effective in preventing illness.
The study was conducted at an Ohio Children's Hospital from October 2020 through April 2021, when pandemic measures were in place. Researchers found just 2 cases of flu and no cases of RSV. When restrictions relaxed in mid-March, viral infections returned. Dr. William Schaffner is an infectious diseases specialist at Vanderbilt University Medical Center.
We didn't really expect that we would see spreading of winter respiratory viruses in the summer. It just shows you that these viruses, which are really very contagious, will take advantage of us as we open up, gather together, take off our masks.
We wash our hands when we get home, and we generally make sure that we eat well and sleep.
The Noacker family hopes these habits will keep them healthy this winter. Michael George, CBS News, New York.
The CDC recommends everyone ages 6 months and older receive the flu vaccine with rare exception. Lawmakers were back at the state capitol today despite approving 2 redistricting maps yesterday. The Senate briefly convened this morning before recessing until this afternoon, while the House met to discuss and vote against another COVID bill. But representatives eventually voted to end their session. Meanwhile, the 2 versions of the same congressional map are now on the governor's desk. Both proposals split Pulaski County into 3 U.S. House districts, breaking up portions of the county among the 1st, 2nd, and 4th congressional districts. It's that split that has several lawmakers, including Representative Andrew Collins, worried.
Depending on where you live in the county, your member of Congress is going to be different. I think that's going to be very difficult for people in Pulaski County.
On the other side, Representative David Ray says there will be 4 Republicans in Congress regardless of which map you use. He says that no map was going to make everyone happy.
I think a lot of what's going on in there is just, a lot of theatrics, frankly, people trying to get worked up over lines that are really going to change not a whole lot.
Governor Asa Hutchinson's office says he'll take a closer look at the bills on his desk and make a decision sometime next week. Most viewed on thv-at-noon this afternoon. For years, the side of the Majestic Hotel in Hot Springs has sat empty, but that could change soon. A native Hot Springs developer, Rick Wilson, has plans in motion to turn the grounds of that old Majestic site into an entertainment venue featuring a pavilion seating up to 5,000 people. He offered the city $2.1 million for the site and says engineers will be laying the foundation for the next 6 months.
We expect construction activity to take 9 to 11 months, so that puts us completing this project in roughly January to February of 23.
The first event already planned for that spring break in 2023.